Diseases caused by astroviruses. So Astroviridae, they are single-strand RNA viruses. They're non-enveloped, which means they're very resistant to pH and temperature. They have a unique surface structure. They resemble stars, hence the name Astro. There are two genuses, the mammal AstroVirus genus and the avian AstroVirus genus. The mammal AstroVirus genus affects mainly animals in winter, and they cause gastroenteritis in cattle, swine, cats, and humans. The avo-astrovirus genus has chicken astrovirus, duck astrovirus, and turkey astrovirus. Chicken astrovirus causes avian nephritis 1 and 2. Duck astrovirus causes duck viral hepatitis, and turkey astrovirus causes diarrhea. In avian nephritis, the occurrence is widespread, but it's frequently seropositive. Clinical signs are not common. For the etiology, it's caused by the avian nephritis 1 virus, and there's also the avian nephritis 2 virus. They have virulence variants. For the epidemiology, only chickens are susceptible. Animals around 1 to 4 weeks old are most susceptible, but it can affect animals of any age group. At week 1, the mortality is around 1 to 10%, and the virus is shed in the feces and it's able to survive in the environment. For the pathogenesis, the virus enters the body through oral uptake, and then primary replication happens in the gut epithelium, and then viremia occurs and secondary replication happens in the target organ, the kidney. Specifically the epithelial cells of the proximal tubules. Then nephrosis and interstitial nephritis occurs, which causes uricosis. In the clinical signs, in an acute case, it's not specific. We see anorexia, depression, stunted growth, retardation, and decreased weight gain and diarrhea. In the chronic form of the virus, we can see urate crystal deposition and death. In the pathology, we can see enteritis, interstitial nephritis, so an enlarged kidney, and nephrosis, and uricosis in chronic cases. For the diagnosis, we look at the epidemiology, the clinical signs, and the post-mortem lesions. To detect the virus directly, we use a real-time PCR, IF, and immunohistochemistry. The isolation is difficult because it has to be done in a chicken embryo kidney cell. And to detect the virus indirectly, we use ELISA. The differential diagnosis can be the nephropathic infectious bursal disease strain. For the treatment and prevention, there's no treatment, and for the prevention, you follow the general epidemiological rules, and there is no vaccination. The next disease caused by astroviruses is duck viral hepatitis. There are actually 4 causative agents. Picornavirus causes duck viral hepatitis A, and the second and third duck viral hepatitis viruses are actually caused by duck astroviruses. There are 2 serotypes. And the 4th virus is actually caused by duck viral hepatitis B, which is actually a hepatinovirus. For the pathogenesis, clinical signs, and post-mortem lesions, they're very similar to the picornavirus duck viral hepatitis, but the only difference is there's less mortality in the astrovirus viral hepatitis in ducks. And in turkey astroviruses, the occurrence is widespread. The etiology, there are 2 serotypes, and the clinical signs are diarrhea in 1 to 5-week-old pullets. The diagnosis is the same as avian nephritis, and for prevention we follow the general epidemiological rules.